Hi, my name is Emily Haller, and I am a registered dietitian specializing in digestive disorders. I work with the Division of Gastroenterology and Hepatology at Michigan Medicine. Thank you, IBD Journal Club, for the invitation. The article I chose to present is Perceptions and Psychosocial Impact of Food, Nutrition, Eating and Drinking in People with Inflammatory Bowel Disease, a qualitative investigation of food-related quality of life. Extensive research has been conducted on the impact of IBD on nutrient intake, requirements, and metabolism. And by contrast, there has been limited research examining the psychosocial aspects of food, eating, and drinking in those with IBD. We know that food is more than fuel for our bodies. There are social, emotional, and cultural aspects to be considered, and people with IBD consider this to be an important area for research, and the study aimed to address this unmet need. In-depth, semi-structured qualitative interviews were conducted to explore the perceptions and psychosocial impacts of food, nutrition, eating, and drinking. The study selection criteria included patients with Crohn's disease or ulcerative colitis. Participants had to be 16 years of age or older, and there was no upper age limit. They had to be able to eat some food by mouth, consent for themselves, and speak English fluently. Participants were excluded if they were currently treated with exclusive enteral nutrition or parenteral nutrition and did not eat solid food. Additional exclusions included being pregnant or breastfeeding, having a diagnosis of an eating disorder, or other chronic illness, such as end-stage renal disease, that could affect the participants' ability to eat and drink normally. The interviews focused on the issues of food and symptoms, food and social interaction with family and friends, the effect of food and eating on symptoms, effects of food, eating, and drinking on life and nutritional status, and adaptations to manage these issues. All interviews were conducted face-to-face. Participants were encouraged to openly talk about issues that had the most relevance to them, and responses clarified and probed as necessary. All interviews were audio recorded and transcribed verbatim by a professional transcriber. Thematic analysis was undertaken based on Colizzi's 7-step framework, which allows researchers to reveal emergent themes and their interwoven relationships. A total of 28 patients were interviewed, 16 with Crohn's disease and 12 with ulcerative colitis. The median time since diagnosis was 7 years. The interview time ranged from 29 to 91 minutes, depending on the detail of respondents' accounts. There were no noticeable differences of food experience between people with Crohn's disease and ulcerative colitis, so the results were presented together for these two groups. 5 themes were identified from the data, each containing several sub-themes. Theme 1 was personal experience of relationship between IBD and food, and the sub-themes were around this bidirectional relationship between IBD symptoms and impact on food intake, as well as the impact of food intake on IBD symptoms. Theme 2 was managing diet to control IBD and its symptoms, with the sub-themes being experimenting with food intake to manage symptoms, food avoidance, exclusion and substitution, good foods and bad foods, the frequency of eating, portion sizes and planning ahead, healthy eating, vitamins and minerals, and eating preferred food and dealing with the consequences. Theme 3 was impact of food-related issues on everyday life, with the sub-themes of being organized, shopping, recipes, and food preparation, the impact on family, personal, and professional life, and social occasions and dining out. Theme 4 was acceptance and normalization of food and its impact of IBD, accepting new situation and normalization, being in control, and missing the pleasure of being unrestricted about eating and drinking as the sub-themes. Theme 5 was sources of information and support, with the sub-themes being not knowing enough, conflicting information regarding food and IBD, health professionals, family and friends as sources of information and support, and limited resources of information and support. In the results of each theme and its respective sub-themes are direct participants' quotes along with their gender, age, and diagnosis. Here are just a few that I pulled from the third theme on the impact of food-related issues on everyday life. As a result of actual or perceived food restrictions related to IBD, grocery shopping and food prep was more time-consuming, meal times, when and where a person ate, as well as the ability to eat with others were impacted. The qualitative design allowed for an in-depth exploration of the participants' experience of how IBD impacted their food-related quality of life. The authors noted a benefit of using semi-structured interviews is that this format sets the boundaries of the topic and direction of the conversation compared to an unstructured approach. The limitations of qualitative research are that it involves a small number of participants and the findings relate predominantly to these individuals. However, it is expected that the findings will be transferable to similar contexts, in this case, people with similar clinical and demographic characteristics. The authors of this paper highlight that greater effort needs to be directed towards recruiting participants from more diverse ethnic and cultural backgrounds. Semi-structured interviews may restrict the participants to primarily cover the topics set out by the interview guide instead of covering all of the aspects related to their experience. The study demonstrates IBD has a profound impact on psychosocial aspects of food and nutrition, which impacts food-related quality of life. A lack of reliable resources, good quality information, and limited guidance and support from healthcare professionals left participants struggling to find effective management strategies. People with IBD need diet and lifestyle advice that will help them to make positive adjustments, and there is a need for research to identify interventions that will improve food-related quality of life in our patients with IBD. Thank you for your time. Now, I would love to hear your thoughts on this article.